Mandatory early screening for autism spectrum disorder. Help parents help their children. Presented by Cheyenne Cody-Da, co-authored by Noelle Franks, Cody Halpert, Mi Nguyen, and Kelsey Whitelaw of Arizona State University. Imagine this. You are at a play date with your 18-month-old and your friend who has a child the same age. You notice that the other child is playing alongside other children in the playground, but your little boy is sitting alone off to the side. Later, your friend's little boy comes up to her and asks for Wawa. And then he's given water. Your little boy has never asked you for a drink, and now that you think of it, he never asked for anything. You have been picking up on these small signs the last 2 months as you've been meeting your friend for playdates. Your friend's little boy is constantly babbling, using words to get his needs met, while your little boy is content to play quietly on his own. When you try to get your little boy to engage with you, he usually does and will let you play with him, but his favorite activity is just to line up all of his cars and then flip them over so he can spin the wheels. When your friend's little boy comes over to move the cars along the track, your little boy becomes very upset and it's hard to calm down. These playdates have been occurring on a weekly basis, and although your little boy will play alongside the other child, he seems to not notice him at all. You are concerned, but he has stayed home with you for all of his life, and this is his first real friend. So you brush it off, thinking he's an only child with little opportunities for socialization. So what should you do? Talk to your doctor? At your child's 18-month well check, everything seems to be going along well. But you can't stop thinking about the playdates. You decide to bring it up to the pediatrician just to see what she says. You bring up your concerns with his socialization and his lack of speech. You describe what is going on at the playdates and talk about how your child is not imitating you or the other children, and he's pretty quiet all the time. The pediatrician politely listens, but then she reminds you that he's still young and you should give him some more time to develop speech. The pediatrician suggested that you put him in a daycare to help with socialization and communication skills, as he seems to just be really shy. Your pediatrician ends the appointment by saying, "Let's just wait and see." This is a common response from pediatricians. In fact, a 2016 study found that 50% of pediatricians took a wait-and-see approach to developmental concerns. Meanwhile, your child's behavior worsens, and it's causing you to be stressed out. A study conducted in 2003 found that parents of children with developmental delays are more likely to suffer from parental stress. You know that your child is different from other children his age, but if your pediatrician is not concerned, then maybe you should wait and see. After all, your pediatrician knows best, right? Fast forward to age 4, you have waited and now you see. Your child has now been diagnosed with autism, and the concerns that you brought up starting at his 18-month check were indicators that could have been caught on the autism screening tool that eventually led to your child's diagnosis. The MCHAT is a screening tool designed as a checklist to screen for autism in toddlers at ages 18 months and again at 24 months. The concerns you had would have elicited at least an at-risk diagnosis from a developmental pediatrician or psychologist. Unfortunately, you were never referred to either. Your child could have been receiving early intervention services up until age 3, and you would have received support to get services after age 3. Now you have to navigate the state systems all alone and try to figure out what services are most appropriate for your child. The Centers for Disease Control and Prevention Community Report on Autism found that only a small percentage of those children identified with developmental delays actually received a comprehensive evaluation. This is important because it serves as the root cause for delays in diagnosis. There are numerous other factors that play into delayed diagnosis, such as cultural and socioeconomic factors. However, mandatory best practice screenings can serve as the catalyst for change in getting early diagnosis for these underidentified populations. After all, every child deserves the opportunity to live to their fullest potential. Of children identified with ASD, over 90% had developmental concerns by ages 3, but only 34% of those received a comprehensive developmental evaluation by 3 years of age. There are many programs out there to support children with developmental delays, including the Arizona Early Intervention Program and other programs around the country. Programs like AZIP can help parents navigate state systems and provide parents with information on child development and resources. It is unfair to the children in Arizona to not receive something as simple as an evaluation. How does autism affect parenting? 1 in 64 children in Arizona are diagnosed with autism. Parents with children with the autism diagnosis, they suffer from stress and mental health problems at higher rates. Things like depression and anxiety, these are things that parents of children with autism are experiencing on a frequent basis. Early interventions, which include parenting interventions, were also found to reduce parental stress, helping parents' competence and confidence levels rise. The Arizona Early Intervention Program provides a team of trained therapists, developmental specialists, psychologists, and social workers to children that qualify for the program. The team works in the home directly with the child's caregivers to provide intervention services. For children with an at-risk or diagnosis of autism, applied behavior analysis is a service they can also benefit from. ABA services cannot be provided through the Arizona Department of Developmental Disabilities until a diagnosis is reached. An official diagnosis is required in order for insurance to cover the cost of treatment for ASD, such as ABA therapy. A primary focus of many of these services are to help support the child's caregivers, which in turn helps to lower parental stress levels. Parental stress. Significant levels of parental stress are linked to lower levels of parenting competence and confidence. The inability to connect with the necessary services and supports have been identified as one of the primary factors that cause parental stress. A study conducted in 2010 indicated that providing parent-focused interventions, including professional support and guidance immediately following a diagnosis of autism, can lead to significantly reduced levels of parental stress. Additionally, parents will engage in higher rates of parental efficacy and competence in managing their children's challenging behaviors and feel comfortable seeking out necessary therapeutic treatment modalities for their child. With support, parental stress can decrease, resulting in feelings of competency. However, parents are left helpless due to insurance requirements until a diagnosis has been provided to their child. Arizona's children deserve access to all resources available to them. Mandatory autism screenings can get Arizona's children diagnosed at earlier ages. Children in Arizona are being diagnosed on average at the age of 4 years and 11 months. This is years after the American Association of Pediatrics recommended toddler screenings at ages 18 and 24 months. If screenings are available at 18 and 24 months, why are children not being diagnosed until they are almost 5 years old in Arizona? The need to screen at least twice is done in order to catch children who regress after the initial screening. However, these children are still falling through the cracks. Nationally, the median age for diagnosis is 4 years and 3 months. The screening tools available are simply not being used by pediatricians. If the tool was being used at the appropriate time, children could be referred to other physicians, providers, and programs to get further testing and evaluation completed. Once diagnosed, children can start receiving early intervention services, can gain higher IQs, decreased behavior symptoms, autism diagnosis, and improve parent-child engagement. Research shows us that the earlier the child receives interventions after a diagnosis, the more likely they are to show the greatest developmental strides. And so what does this all mean? Well, out of 16,312 children referred to Arizona Early Intervention in 2017, 6,524 of those children never even made it to an eligibility determination. It is important that Arizona pediatricians stress the importance of early detection and early intervention to avoid having 6,000 plus children not receive evaluations and receiving the support that they need. However, if the doctors aren't screening, they're not going to pass along this valuable information to parents. And the benefits of early diagnosis and early intervention are huge. When left untreated, symptoms of ASD can become more severe and require more expensive interventions. Early diagnosis leading to early intervention could potentially prevent these costly interventions later in life, as well as saving from 18 years of special education. A study conducted estimated that a state could save over $1 million per child over their lifespan when employing early interventions. Although pediatricians are not to take the whole blame for all of this, they are the ones that are most trusted by parents, and they're often the professional that the parents see the most often. It is true that factors such as parents' socioeconomic status, race, and birth order can all have a big impact on age of diagnosis. A survey conducted by the AAP in 2009 revealed that only 47.7% of primary pediatricians were effectively utilizing standard screening methods. Another study in 2011 found that 14% of children have a developmental delay by age 2, but only 10% of those identified are receiving services to meet their developmental needs. There are many different factors that could affect the lack of service, including parents' unwillingness to participate. It is important that parents understand the implications and the ramifications that could occur when children are not receiving the appropriate services. This information needs to come from the pediatricians that the parents trust. So what can Arizona do about it? Make early screening mandatory. Establish a best practice protocol. To address the need for pediatrician screening of toddlers, it is recommended that the Health and Human Services Committee establish a best practice protocol for early autism screening by pediatricians. This would require that all pediatricians in Arizona employ the Modified Checklist for Autism in Toddlers, otherwise known as MCHAT, to screen toddlers at 18 and 24 months. A study in 2013 showed that the MCHAT's effectiveness in diagnosing autism early and requiring the MCHAT as part of an autism screening best practice protocol ensures early diagnoses are happening. Temple Grandin says, autism is a neurological disorder. It's not caused by bad parenting. It's caused by, abnormal development in the brain. The emotional circuits in the brain are abnormal. And there are also differences in the white matter, which is the brain's computer cables that hook up the different brain departments. Temple Grandin is a pioneer in the autism community, and this quote perfectly resonates the education she has been trying to provide to others. It is important that we all remember that although autism is not caused by bad parenting, it can be challenging to parent a child with autism when parents do not have access to appropriate resources. Most people can agree that parenting is not easy. It is a challenge that many people take on each day, and it is one that never ends. When reflecting upon their parenting skills, most parents can say that they have given it their best shot. Early detection of autism helps relieve parental stress as it gives parents an answer to their questions and concerns. The resources available for children with autism and their families is abundant, but the ability to access it without a diagnosis is limited. The MCHAT is an important tool that all Arizona physicians working with children should be employing and utilizing within their practice. It provides early enough detection to get a child referred to the appropriate programs for possible at-risk or diagnosis of autism. A simple diagnosis of autism in Arizona could provide these young children with early intervention services, ABA therapy, respite for their families. It is stressful enough to be a parent. Let's decrease the stress a bit by helping Arizona's children with autism access the resources that we have available. Let's catch these diagnoses early so that by the time Arizona's children with a diagnosis of autism is 4 years old, his or her parents are more confident in their parenting skills and they feel comfortable to provide support to new parents learning about the diagnosis. Thank you so much for your time.